So let's dive into a little bit of the aesthetics of the face. And I've had this slide before. This is the Mona Lisa, of course, everyone knows. And there are some golden ratios. And if we kind of look at some people who are obviously considered beautiful in our world, I sure wish I had Bradley Cooper's ratios and golden ratios. But these are some of the scientific ratios that we look at in the face that can give us little hints of what is beautiful. And so we try to, on the end of plastic surgery, look at the scientific ratios. But the reality is, we all age and none of us are immune to aging. So we are all, I call it the analogy of grapes, and we're all grapes when we're young. My 6-year-old has nice cheeks. And ultimately, when we're towards the end, we're getting pretty dehydrated, losing volume, and ultimately becoming raisins. So perhaps at 90 years old, we see this. And as through volume loss, we see wrinkling and we see loss of volume. So generally speaking, I won't get into the initial aspects, but my beautiful wife who does all of our injectables in the practice, she actually is kind of the gateway in the beginning of how to define and aging in the very early process with fillers. And so you are all pretty educated in doing volume repletion with voluma and fillers to, again, really bring back volume in our cheeks. And so what's happening, again, if we look at why and what's going on with aging, is we have this inverted triangle of youth, kind of this heart shape. And then as we age, we are all turning into flipping that triangle over and ultimately almost looking like squares, so to speak. So we're going to look at those various areas. What's happening is that volume loss combined with gravity leads to drooping of the brows, our eyes get hollow, and ultimately our cheeks sag into the nasolabial folds, and then our neck sag as well. So one of the things, some of you may know me and some of you are getting to know me, but I think it's important to know your surgeon. And I'm always using a trilogy approach in terms of how I approach any part of the body, as well as how I approach the plastic surgery aspect. So ultimately, I'm looking at the science, again, those ratios and what we learn in medical school and drawing lines and making sure our ratios are right on. Those are certain goals. But really the most important is the artistry of it. So as I'm looking at the face, just like the sculpture, I'm looking at the artistic component. And it's very important for me to understand also the patient, your artistic vision. A lot of the times I will also use models and I will use photos to, again, really look at that vision of what you are looking for in terms of rejuvenation. So again, a little background of me. This is not me, but I found this photo of I was a violinist when I grew up. My mother's a violin teacher, and she forced me to learn early on, of which I didn't enjoy it in the beginning, but of course now I appreciate it. But I think this artistic component is very important. Again, the musicality and the creativity. This guy looks pretty passionate here and is having a moment here, but again, this is very important to really employ that artistry in my surgical in my surgeries here. I'm going to brush through pretty briefly here, not to give you a science lesson, but it is important to look at certain anatomy. We're going to be looking at the eyes, and really we're looking at volume loss and ultimately skin drooping. I'll cover briefly upper lids and the lower lids. And then, of course, the jowls, which is ultimately the manifestation of the cheeks dropping into the lower cheek area. And this is often combined with the neck. So the jowls and neck will be normally treated with a facelift type procedure. And we'll talk about the eyes as well. So ultimately, one of the things that's very, very important is how we approach and where are these incisions and scars when we're performing a facelift. And I think this is one of the most artistic parts And I pride myself in being very, very precise and exact in terms of where to place these incisions. The scalpel is ultimately like my paintbrush. And if you can see in this photo here, the hairline incisions have to be perfectly placed. If you look at anyone's sideburn, nothing is a line. It's all irregular. And so we have to hide these lines perfectly in the hairline. And then if you look at the ear, we're dropping these into strategic places of crevices behind the tragus here, so that ultimately the bottom line is when your hairdresser looks, she can barely see or not even see. We want these lines to be hidden and nearly invisible, but they have to be placed in exactness. Then the rest of it, in terms of what we do, and some of you who may have heard my abdominoplasty talk, the principles of surgery are the same. And ultimately, even though what you see in the tummy is loose skin after having children, or in the face we see loose skin, really the muscle is ultimately the foundation, the flooring of your body. And that's what we need to really lift. So there was a company long ago you probably have heard of called the Lifestyle Lift, and they really took a lot of shortcuts in really lifting the skin and not addressing too much the muscles and how those need to be lifted. So when you're talking to your surgeon and they're kind of going over this, it's really important for them to kind of identify and talk to you about, yes, the muscles of the face are being lifted. That is the foundation and the flooring, just as in the tummy. That's kind of going to be the most important part. And it's also important, again, with this artistic component that we're lifting in a very natural direction. I've always prided myself in lifting and giving you a natural result, a natural lift for the face. If I were to pull horizontal like this, boy, that's going to give you that kind of the Joan Rivers pull of the mouth that is very unnatural. So the vectors are very, very important. Again, that takes the artistry to give you that natural result. So we're going to run through a couple of befores and afters here. And what's important when we're looking at this is a very young patient of mine, and I believe in her kind of 40s and entering 50s, whereby you can see really the action is very subtle here, but you can see some very sharpening of that mandible jawline and then reaccomplishing the neck angle there. So again, a different angle, but it focusing on the jowls here and the neck. And this all comes up as a unit together. And what we're trying to do is really reestablish that jawline and the neck angle. And finally, just another angle of another patient. Everyone has different individualistic anatomy. This was a neck that was a little bit more challenging in terms of the drop. Sometimes we have a obtuse neck angle and we want to restore that neck angle. And that's a lot of times what we see on our Zoom calls as we're looking in. Just some more results as we're looking at as a front view. Now we can see some jowling and again the neck. We will also get into the eyes and how we rejuvenate the eyes often at the same time because we want to rejuvenate both the eyes and the neck together. So again, we're achieving a balanced overall appearance. So again, this patient received similarly a facelift, which is approaching and accomplishing the jowls and the neck in terms of restoration. As you can see, the eyes were addressed all at the same time. We'll go into recovery as well, but generally it's a very quick recovery. So let's talk a little bit about eyes in a moment. Oftentimes, however, the facelift recovery is very, very quick. And so generally speaking, I tell patients you want about a week to hide out. And it's more of a cosmetic recovery whereby you're not really feeling much pain. It's very minimal in terms of pain. It's very minimal in terms of swelling as well. But you do need a week to hide out, so to speak, just to let that swelling go down. And after 1 week, all of the little baby sutures are taken out. And ultimately, just after a week, you can go to a nice dinner once the restaurant's open and we're able to go somewhere. But at a week, and also with females having beautiful hair, you can cover the incisions very, very easily. The only thing that lingers a bit is swelling. I call it the chipmunk cheek, kind of in the lateral aspect right here, in terms of letting that settle down for another week or two, couple of weeks. And usually my patients at the 3-month post-op are coming back for their after photos where they're looking absolutely beautiful, and the majority of swelling has gone away and the scars are nearly invisible at that time. So the face heals very quickly, very different from the body because of great blood supply, and things heal very quickly. So that's the nice thing about facelifts. And whether I'm doing eyes and neck at the same time, all of it generally is going to heal in about 1 week, which is a very quick time for the face. So again, as we're in this kind of pandemic with the masks, we're certainly focusing a lot more on the eyes, which again are the windows to our soul. But again, sometimes we, even myself, I'll say, boy, I look tired, or you get if you ever get the "you look tired" comment, that's ultimately manifest and displayed in our beautiful eyes. The masks definitely accentuate that. We're definitely communicating more through our eyes, whether it's direct or even through social media or Zoom. I wanted to thank my employee Des for offering these wonderful photos, which she captured, which ultimately display a day by day in terms of recovery. And so she was very nice enough to really capture these moments. And so I wanted to focus on a couple things. This was an upper lid surgery and a lower lid fat removal, as well as a chemical peel to tighten up the skin in the lower lids. So this just shows you a day by day in terms of how we're healing, or I'm sorry, she's healing. And you can see by day 3, she actually healed phenomenally well. Her swelling's going down pretty quickly in the upper lids. What you're seeing in the lower lids is the chemical peel. A laser will do a similar effect in terms of what it's doing is heating up and peeling off, it, almost as if a sunburn, the lower lid skin, and ultimately what it's doing is tightening up that skin. So by day 5, a lot of the swelling is gone, and ultimately her peel is starting to take effect. And then 2 days later, her peel is done. Her upper lids, she's still swollen in these areas. My wife actually underwent, she'll talk about her story, and she's a bit swollen after a couple weeks as well. But I mean, this is just a phenomenal change and transformation. I mean, when Desiree came to me, I didn't think she needed anything done, but this very subtle enhancement can show just an absolute rejuvenation of the eyes. So ultimately, if we're looking at the lower lids, this is fat removal here, tightening of the skin, and then just getting the upper lids to be subtly but really just refreshed. And I just want to re-emphasize again, this is, I mean, to me, I look at Des and I wouldn't even think that she had anything had done. And that's how I approach every patient. I really want it to be a natural result. So again, thank you to her for really displaying those day by days. And that's really what to expect when you're undergoing upper and lower or eyelid surgery overall. The neck, again, heals in a very similar fashion. However, just a little bit of swelling in the side cheeks there. So the most common question for all of you is, when is the right time to do this? And I think for all of us, it's a very individualistic approach. We all age at different times. And ultimately, the second question is, how long is this going to last? And so my point is, I answer this question that there are a couple points that when you look at this frame by frame of going from the 20s to your 60s, I think a lot of us in our 30s are doing the injectables such as Voluma and Botox, and that can bridge the gap until ultimately we're looking at surgery. And oftentimes I would say that the earliest that people are coming to me with these goals is right around the age of 40 and 50. Now, if we look, this is a pretty nice timeline at age 50 as compared to age 30, you can see the dropping of the jowls and the neckline and some eyelid bagging and drooping. Now, this red line shows that this is my goal. What I'm trying to do is I'm trying to rewind your biological clock so that ultimately you are back 10 to 15 years younger to where you were. So when you are age 50 and the surgery is done and you've healed, the waiter or waitress should say, ma'am, are you 35? And so you can see this red line where we're rewinding back your clock. Now you will still age, but you've rewound that clock 10 to 15 years. And again, if I were to say I'm going to put a time travel back from age 50 to 30, you look at the 30-year-old, we want a natural result, a youthful you again. So again, no one really, at least in my practice, wants a pulled look. We're really looking for a natural, refreshing rejuvenation. And I know I've succeeded when all of your compliments are going to be, no one really noticed, but they really thought I looked rested or really fresh. And so that's the ultimate goal here. So with that, we have this eternal idea of beauty, and we live in this pretty challenging year. But I will end with the fact that, this year has certainly raised a lot of opportunities for us to kind of look at ourselves, both mentally and emotionally. We've all been given this opportunity to grow, but also physically. And I think this is it's a nice time. We all have time to recover and ultimately give ourselves a little bit of introspective gift to ourselves. So again, thank you very much for your time. And it's always a joy for me to be able to kind of discuss and share some of this information. We want to look forward. I think we're going to be, even though we're in a little bit of a rough state regarding the pandemic, I definitely think 2021, we all can't wait for it. And looking forward into the future, give yourselves some happiness there. And I shall open this up to questions.
All right, so we're going to go ahead and open up the floor to questions. And what we can do, if you have a question for Dr. Park, please submit your questions via the Q&A button that's located at the bottom of your screen, sort of down at the bottom in the middle.
Mm-hmm. All right. And do you have anything?
I don't have anything. I want to make sure that this is working. So you can even, oh, there's one coming through right now. Do all facelifts have to include the eyes?
Yeah, that's a very, very good question. I would say that interestingly, when people come to see me for a first time, they're oftentimes coming in focusing on one thing. And the way I approach things is, for example, someone will come in and focus on the eyes or vice versa, the neck. I do evaluate everyone comprehensively, and I will look at everything. And I think it's important to do that, as we saw some of these photos, in order to really balance the face. Because as, for example, let's say we looked at this lower right-hand photo and we just focused on the neck here and we didn't rejuvenate the upper lids, then perhaps you would look very youthful in the neck, and then the eyes may be even looking more aging. So the quick answer is that you do not have to do the eyes. You can certainly stepwise and rejuvenate what you feel that you wish to focus on. But oftentimes I will be looking at an overall balance as well. And so ultimately it's a very individualistic thing. And I really, really like to hear what you have to say as a patient and what your goals are. But you can either stage it and certainly doing face and eye separately or do it at the same time. So again, just based on the individual there.
Great. Thank you, Dr. Park. So the famous question that everyone's wants to know is, what prices are we looking at for a full facelift?
Right. That is a famous question, and I love to have my patient care coordinators involved with that. Um, what's interesting about pricing, and I will say that I will kind of comment on this, is I like to consider my practice and where we're at a very hidden gem, because most of you know that we hear, the Real Housewives at Orange County, Newport, and Beverly Hills. And I often have patients that'll come to me and say, boy, I had a consultation in Newport Beach for a facelift. They were charging 25,000, and I'm just like in shock. I'm like, I need to move to Newport Beach, but ultimately,
Park,
you know,
I end your,
I'm sorry.
hi, sorry, on my end, you're freezing it, so
Me?
I don't know if our
Oh,
viewers missed that chunk.
oh, okay.
Uh,
How are we now? Do you want me to? I can rephrase that question or answer. Are we still doing okay?
yeah, I think we're good.
Okay. So I'm not sure how much of that you got. So I'll just re-answer. The question was about pricing, and the quick comment I was making is that it's nice that in my area the pricings are going to be very different, just due to geography. I mentioned one patient had a quote for about 24,000 in Newport Beach. I will say that the basic pricing ranges anywhere from, I would say, for just a facelift, anywhere from about 8 to 10 to 12,000. So that would be half of Newport Beach. There's no rhyme or reason to that. I just find that pretty amazing that just due to geographic location. So, but I think the most important part is, again, to come in for a consultation so that we can address, every factor and what's involved. Because certainly eyelids, et cetera, will kind of add to the overall plan.
Great. So up next, I have a two-part question. So I'll read the first. Can someone who is diabetic have a facelift? That's the first part. And the second part is, do they heal as fast as a healthier woman, man or woman?
Correct. Yeah, I think that is probably one of the most important decisions that I have to make with the patient. And ultimately, the bottom line is I want my patient to be in their healthiest shape and form. So, diabetes is a very good question. Diabetes, high blood pressure, and smoking are probably the three most common things that we want to address. Number one, smoking is an absolute we need to quit. And because we want you to heal, and so smoking can cause blood vascularity to decrease, and we can have wound healing issues. Now, diabetes is pretty special, as well as high blood pressure, because if it's well controlled with diet or medications, then I have no problems in terms of doing the facelift, and they will often heal well as long as they're well controlled, and probably heal as nice as a person without diabetes or high blood pressure. So as long as a patient is empowering themselves to stay in good health, then I think that they will be go through the surgery without any problems. So the good question there.
Thank you. I have another great question coming up. Uh,
Okay.
what is the difference between a mini facelift and a regular facelift?
That's a very good question. There's a lot of terminology that unfortunately is a little bit vague, but for all intents and purposes, when you go for a consultation or someone is talking about a facelift, really what we're rejuvenating, if we go into this upper left-hand corner, is the jowl and the neck. So it's almost as if this lower half of the face and the neck, that is what we call a standard facelift. Now, if a patient presents, let's say, for example, with just the jowl and the face, then that can be addressed with what's called a mini facelift. So now that is completely opposite of someone, for example, who may need just a neck lift and their face is looking good. So we can divide these up into different proportions. I don't know if you can still see me, um, but the upper face area versus the neck. So we're looking at two different areas. A mini facelift addresses face, and the neck lift will address the neck.
Dr. Park. Up next, I have, what about thread lifts?
Threadless. This is very interesting as well. Um, Ultimately, a thread lift is when people do put threads in order, and usually they're barbed, and they'll kind of hike up the areas of the cheek or wherever you're looking at. I don't know if my wife will allow me to, but she has gone into to experience some of that. And what we found is that there are a couple things that are very important. The threadless can have risks and complications in terms of, some pain as well as the suture sticking out in certain areas. And what is very important to note is when we're looking at minimal type procedures, such as a thread lift, you have to tell yourself it's going to be a minimal result with minimal lasting results. So when we're ready to do a facial rejuvenation in my hands, I want your results to last 10 to 15 years. Okay. I don't want you to come back in a year or two. Otherwise, that's a poor investment in my eyes. So I do feel that threadless are not very good in terms of their overall long-lasting results. So I would say tread very, very carefully in terms of the threadless. I always tell people with technology and different types of procedures, if it's a long lasting procedure that we know that's going to work, then we would all be doing it. But that one, I would say be very careful in terms of looking at thread lifts.
So I know that we've run over our time. There's a lot of good questions here. I would like to just get to maybe a couple more, and
Sure.
then we can end our session.
Okay.
So the next question that I have is, how long does a facelift surgery take?
That's a good question. Short answer in my hands is about 2 hours. I think that if you go to, it's one of the most varied procedures that if you go from surgeon to surgeon, one person may do it quicker and another person may take 3 to 4 hours. I think that's why it's very, very important. I do see some of the questions here that when you're conversing with a surgeon, you want to ask him those questions and ask him, well, what's going on in those two hours or so. So for me, it takes about 2 to 3 hours. I do it under a conscious or IV sedation. That lowers the risk of general anesthesia. So that's very, very important. And so you're in a very relaxed, sedated state. And ultimately, I can see one of the other questions. They're asking about the muscles. I'm going to stress that again, you want to ask, are you addressing the facelift muscles and how we're doing that? Because that again is what's going to give you that 10 to 15 years. That muscle carries the skin and holds it for that longevity. Skin, as we know, will drop very quickly. So if it's a skin lift, it's not going to be very long lasting.
So we'll take, I wanted to get to this one last question to make sure that we answered, because it was a little bit on the personal side.
Mm-hmm.
I have a scar on my cheek. How will that affect the aesthetic of a facelift?
That's a good question. I would like to kind of see what the scar looks like, whether it not needs to be improved. Also, ultimately, want to see where the location of it is. If it's in the central part of the face, it's probably not going to be moved or affected in any way. Now, if it's closer to the ear, and let's say it's kind of in the lateral outer part, there's a good chance it's going to move far back and even potentially removing that scar. So ultimately, it depends on the quality and location of the scar. And if it's a scar that I can potentially revise and to look better, that's something I'm looking at as well.
So I think that we are just about out of time. I know that we've run a little bit over. I want to thank everyone so much for being here with us.
Absolutely.
Please remember to be on the lookout for your discount offer later today in your email inbox. And if you're ready to take the next step and find out if you're a candidate for a facelift, neck lift, or any other procedure that you've been dreaming about, please call or visit our website to schedule your free consultation and let us be a part of your journey to a more beautiful, youthful face and body. Thank you, everyone.
Thank you, everyone. Thank you, Yvette, my staff, Fast Track, and everyone. It's been a really, really fun, challenging time, and I really, really look forward to meeting you folks in the future and just educating. And if you have any questions, I'm always open. Instagram's a great platform, or Facebook, Face and Body One, and would love to engage with you guys. All right. Okay.